Hello. Hey, happy Sunday. Good evening. Happy Sunday. And welcome to Say It's Sunday. I'm your host, Angela McGowan, a professional healthcare advocate, caregiver strategist, author of How to Get Out of the Hospital Alive. Actually, it's what you don't know could kill you, How to Get Out of the Hospital Alive. And I'm the founder of Angie's Pace. As patient advocates committed to excellence, happy Sunday. Thanks for joining me. And of course, as always, you have the opportunity to come on live, to submit your questions, give us your opinion, and any situation and circumstances that you might want to talk about. But of course, when we start off, most important thing, because it is what, not just say it's Sunday, it's Caregiver Sunday. Two things. That's right. Those two words. Thank you. Thank you, caregivers. You are absolutely awesome. You are irreplaceable. You are the foundation. You make it work. You're the cornerstone of what most people have the ability now to survive, not just survive, but actually to thrive. And so today, just in case for some off chance reason, someone didn't say anything to you this entire week, someone didn't thank you, show appreciation, just know, hey, it's my honor to say that to you. Thank you, caregivers, for everything that you do. You're selfless. You're always putting someone else's need and care before your own. So we want to thank you. And we want to always give opportunity to recognize you. So we're talking about medications again this week. And so let's get with it, right? Medication care and choices. Are medication choices now financial? Well, actually, I don't think they're now financial. I think they always have been, and maybe it's becoming more prevalent to choose whether or not to have all your medications, to have food, to be able to have shelter, to be able to pay your bills. Um, are you doing medications out of order? Are you now becoming your own prescribing physician in the way that you have decided to dispense your medications, take your medications? Let me ask you, when you're thinking about these choices about your medications, have you ever thought of the choice and the risk during a natural disaster? Well, of course, a hurricane hit a few days ago, and just as late as Friday on the West Coast, another earthquake. Okay, so I want to talk to you about medication choices and the risks they incur, not just what's happening in your body and your health care, but the fact that depending on the disaster, you might only have those medications that you have on hand, and you might not be able to get any more for a few hours, a few days, or even a few weeks, depending on like I said, the disaster and where you are when it occurs. Here's something else important. Hey, caregivers, are you thinking about your own medications as well as the ones for your loved one? Are you also thinking about, I'll just get this amount, or I'll just get this one and I'll always go back? I have a few extra, or maybe it's a medication you've taken before, you stopped, you're on it again, so now you still have some leftovers. Okay. Hmm. Let's talk about what we can do to avoid a lot of the situations that we usually put ourselves in. First of all, when it comes to your medication, do your homework before you go to your doctor's appointment. Okay, depending on the type of doctor, and if you expect a refill, let's just say for ladies, if you're going to a GYN appointment and you're expecting about birth control pills to be dispensed or whatever, find out, if there is, well, I always say you can get samples right there in the office, and that'll be for the free. But just in case, you should also find out if maybe there is another type of um, birth control pill that's, of course, in line with you, that you could take that would be less. Maybe there's a generic of what you take. Maybe you're taking the brand right now, and maybe you could ask for the generic. That would help you financially. Or if you're going to a doctor, you have an allergy or asthma or something else, you want to also find out if there's more than one medication that will be able to help you and take great care of you, that would also help you with your copay or your cost. Always, always, yeah, I've thought of this, use your pharmacist as a resource. Okay, if for whatever reason you already have these prescriptions and you have refills, you can ask your pharmacist before the refill goes in, is there another medication that's like that? And the pharmacist could call your physician and get it changed. Pharmacists also are aware of programs, discounts that come up sometimes because of your insurance, sometimes because of your age. But these are things that are not always accessible, or they're not always spoken to you at your doctor's office, or maybe if you, as I said, are getting a refill from the last time you didn't go back, so maybe this is a new program that has been implemented. Ask your pharmacist, especially if you've been going there for a while. You should always get to know your pharmacist. You should always talk and find out, is there a suggestion, because they handle thousands and thousands of medications every single day. And they are a great resource, especially a great resource if, let's say, it's not for you, it's for your parent, the person you're a caregiver, or whoever it is. And you want to find out, what about the side effects? What is there something else? And then when you go back to the doctor, you can put that into play. You have information, and now the doctor has to get his pharmaceutical book out and begin to look up and compare based on the information you're bringing. Because remember, at all times, we want to represent ourselves as powerful patients, okay? And powerful patients are always prepared. We're always finding out information, and then we're bringing it to the expert to, to have that partnership and that collaboration, so that we as patients are getting excellent health care according to our benefit package. Absolutely. Now, I did talk about samples, but listen to what I'm saying about this. Nothing wrong with getting samples. I'm not against that. But remember that 9 times out of 10, the samples that you're receiving from the doctor, okay, they are usually the highest priced medications. That hence why they can afford to do what? Give you samples. Those, let's call them something else. Those pharmaceutical companies spend millions of dollars marketing, okay, going to individual doctor offices and giving them samples that they could give out to you, so that, because they're so sure, so that you can be the judge. And then when you go back, you ask, and the doctor says, I'm going to take you off of this one and put you on that. You've already had samples, and you'll say, oh, I like that. And then when you get to the pharmacies, when you find out you like it, okay, maybe it's a little better, but you also are going to have a higher copay. It's going to bring you out of the system that you're used to being in. So just be aware of it. There's always going to be medications that there is no generic for. There's always going to be some. But remember, there's nothing wrong with getting samples, okay? But remember, the samples you're getting are from pharmaceutical companies that have spent millions of dollars developing this drug, millions of dollars in marketing and bringing it to your physician, so they can recuperate millions upon millions back from their investment. Just wanted to share that with you. Just wanted to share. Okay, let me see if I can get my next. Okay, here's something. If there is no generic drug for your medication, you could look into a prescription assistance plan, which is also sponsored by the pharmaceutical companies that create these medications. They know how expensive these medications are, but they also want these medications used in a wide range of population. Okay, it helps them. Then they'll go to the government, they'll go to Medicare, Medicaid, and say, look, how many people need this? You need to regulate or up how much money you're willing to put on this drug, so that more people can have access to it. Okay, again, More people have access. They're doing their own survey. They're doing their own study, right? And they're spending this money, giving you samples, getting you out there, giving an assistance program so that one thing can happen. The government and other agencies will subsidize this for you, and then they can make the millions and millions of dollars back. You need to understand that. Okay, and I want to remind you, what did we talk about last week in regards to medication? First thing I talked to you about was about your, I call them lifer medications. Like, this is it. You've been taking it for 3, 4, 5 years, maybe even more. And I call it a lifer medication. And you're acting like it's a lifer medication because you just go there, call, get refills, or you go there, get it, and you continue to go. Now, one thing that's you would put in the lifer category would be blood pressure medications. But if you are on a diet, if you are exercising, if you are keeping a great record of your blood pressure, both in the morning and at night, that's something you should be taking to your doctor's appointment to see if you can get a lesser dosage of this lifer medication. Same thing with cholesterol pills or anything that is mandated that you take every single day, no matter what. You can't be without it. You need to always get your medications reviewed. Don't just keep taking the medicines, especially if you are you have changed your way of life. You are, like I said, walking, going to the gym, you're giving up certain things, you're adding more vegetables. Definitely, you should be, because a lesser dosage could also mean a lesser amount of money. Okay? Also, regardless of your current daily medications, you need to review them every 90 days. Absolutely. That keeps you from feeling that they're lifer medications. Every 90 days, you need to be reviewing based on your lifestyle changes. Why is that? Because I want you to move from getting things every 30 days anyway. You need a 90-day supply, just for no other reason than to remind you about the 90-day, no, but because of the natural disasters that are occurring back to back to back. This is, if you don't take medicine and you're a caregiver, this is for those that you care for. If you're a caregiver and you have medications, it's for both of you. Everyone, as best as possible, should be on a 90-day supply. That way, if it was earthquake, if it was flood, if it was whatever it may be, the one thing you don't have to worry about is, do I have enough for the next week, for the next 2 weeks? Because where I get my medication, maybe I can't get there. Maybe my loved one that usually does it for me, maybe I can take care of myself, but they're on the other side of town and they can't get the refill. There's several things that could be going on. So why do we want to take risks and take chances rather? Okay, with our medications. And that, of course, a 90-day supply is a different cost, a lesser cost than when you get it 30 days, 30 days. Because we're talking about, are we getting all of our medications anyway? And I tell you, adult children have been talking to us, myself as well. We need to always make sure our parents have an adequate supply of medication, especially if we don't live close by, especially if we're not that person that can go do it. We need to make sure that that is going on. Because listen, you might say, oh my, listen, it's not that much of a problem. Not like if your parent runs out of medication. Now, therein lies your problem. Not if you actually are making sure, making a call, say, can we get this moved to a 90-day? Okay. A 90-day, a refill, okay, also helps you to remember, reminds you to check, is the medication even working? Or am I just going to call and get a refill because it's 90 days? Especially, listen, as I said, if you or your loved one, parent, spouse, children, whoever it is, are taking multiple medications, you definitely need to be checking every 90 days to see, is this something you need to be doing? Can you get rid of one? Can you get rid of two? Or if you're going to get rid of one, that can make a great difference on how you feel on the daily. Maybe you get rid of one and lower dose the other two. That's awesome. So we always want to remember to stay on task with that, not just accept, okay, medication, medication, medication. Okay. I don't know if that was some. All right. Remember, a powerful patient is on purpose. So the reason for the medication is to get better, right? Not just to become a habit. Like I take blood pressure pills and I take cholesterol and I take, no, it's supposed to help you. And hopefully your lifestyle reflects the fact that you are helping as well. So if you can lower your dosage and or eliminate, then it is not a habit, but you are working towards something, which I know is excellent health. And remember, I say this every day that I'm on. Excellent health care is not a privilege. It is your right. So please schedule an annual physical to get checked. Make sure that you get your medications 90 days. Make sure you are reviewing your medications to see, like, is this really working? And this, if not for you, for your parents, for your love, whoever you may love and care for, it's nothing wrong with reaching out about these medications, especially if you feel that someone is not taking their medicines as prescribed because they're talking about cost. Absolutely. I always want to give you the opportunity to go and purchase my book, What You Don't Know Could Kill You, How to Get Out of the Hospital Alive. You can go to the bit.ly link, bit.ly/out alive. And of course, I would love for you to go to Angie's Pace. That's my website. You can use the bit.ly link, or you can have the full link, angiespaceonline.com. Go there and find out all the services that we have to offer you and those you love. And while you're there, or if you don't go straight there, you go straight here. If there's a result you're looking for, you're not getting the results you need for yourself or for those you love, please schedule a call with me at the bit.ly link, Advocate Angie. Hey, that's me. And so it's been awesome to be with you here today on Say It Sunday. Thank you very much for joining me. Those that are here, those are my replay viewers. Thank you. I appreciate you so much. On next week, we're going to be doing a full week about Minority Mental Health Week. Please join me. 9:05 Pacific Standard Time. I'll be there. We'll be talking about it for the next 5 days. All right, caregivers, thank you. You know how awesome you are. I started off talking about who you are and what you do, what you bring to the table, and honoring you with those two words. Thank you. Hey, it's Angela McGowan, your professional healthcare advocate, caregiver strategist. I help you navigate through healthcare's sea of red tape. And I create strategies that allow you to give excellent healthcare to those that you love and care for as you care for yourself as well. It's been an awesome time with you. Thanks for joining me. I'm leaving you with two things: blessings and joy. Why is that? Because they both belong to you. Have an awesome Sunday. I look forward to seeing you on tomorrow, Minority Health Week. Blessings, everybody. Take care. Bye.